This is genelantz on the Workers Beat with KNON.org. We had our UAW 848 retiree meeting on May 14th, 2020, and Kenneth Williams came in and spoke to us about the problems that retirees are facing during this pandemic.
Of these deaths, of the ones that have occurred so far, 8 out of 10 have been for persons who were 65 years old and older. 8 out of 10. In addition, when you look at some of the places where we have hot spots, where it's concentrated at, a lot of it's concentrated in nursing homes and senior long care facilities. There have been more than 16,000 deaths from COVID-19 in these kind of facilities, and this has included both residents of the facilities, but also people who work in those facilities have also suffered. And it's interesting. I tried to look up that information just for Texas, and Texas does not publicly report on the deaths in its long-term care facilities. They don't report that in Texas. Now, retirees, most of whom are seniors, there's some lucky folks who have retired and are not seniors, but most retirees are seniors. Obviously, they're at a higher level of risk from COVID-19 than other parts of the population. But now they also have some advantages. One advantage that retirees have is most of them will have an income stream that is not affected by the downturn of the economy. So, for example, if you are getting a Social Security check, they're not cutting your check, at least not at this point, because of COVID-19. If you have a defined benefit retirement, and most of the people on this call probably know what that means. You know, you have a job, you work there for 30 years, keep your nose clean, they give you a check. You don't have to fund it yourself, as in the case of a 401k plan. If you have a defined benefit retirement check, your check is still the same, even though the economy is turned down. Now, for the people whose retirement is based on a 401k or an IRA, yeah, they've taken some hits because most of those kinds of plans are kind of, they reflect the stock market to a large degree, because many of the funds, the mutual funds that you invest in those kinds of retirement systems are tied closely to the stock market. Stock market goes down, your 401k plan tends to go down, or your IRA. But still, even if it went down somewhat, you're still in a better spot than somebody who lost their entire income because they were laid off from a job. And we have well over 20 million people. I've even heard estimates over 30 million people who have been laid off from jobs because of COVID-19. Retirees are in a better place than those poor souls are, because some of them, they don't have anything coming in the door now. They might have gotten a stimulus check. Okay, that's $1,200. Whoop-de-doo. Okay, how long is that going to last? And some people haven't received that yet. Unemployment, there were some actually good benefits for unemployment, thanks to some changes the Democrats pushed through on the big stimulus bill, where they added $600 a week to unemployment. That's good, but that's only scheduled to go to July. I don't think COVID-19 is scheduled to stop in July. So, and then there are states, crazy states like Florida, that engineered the unemployment system to be hard to file for unemployment. And I don't know if you've seen on the news, long lines of people standing in lines for hours to file for unemployment. It's crazy. At least we're not quite that bad here in Texas. You can file for unemployment online. But we have a mixed bag around the country. The bottom line is lots of people who've lost their jobs, and other people who may have lost their small business. They don't have any income coming in now. Retirees are in a somewhat better place from that vantage point. Another thing that works a little bit better for retirees than for some of the other people is many of the retirees who are 65 or older can have health care through Medicare. Again, you're not losing your Medicare at this point because of COVID-19. When people have health care through their jobs, many of these people, millions of them, have already lost their health care because they've been laid off a job. So they're in the middle of a pandemic, a healthcare crisis, and now they don't have health insurance. So that's a crazy system, but that's the system we currently have. Now, and so we're adding to our already huge uninsured population. The one thing when I look at the retiree situation, retirees are in probably the best strategic position to fight politically for a better America in the face of the pandemic. We have the ability and the time to register to vote, to help get other people registered to vote. We have, and the time to promote voting by mail. We can also do things like phone banking and text messaging and posting to social media to get out the word to people about the dangerous and destructive policies of the current administration and why it is so important to vote these people out of power in the November election. We need to do this not only to protect our own lives and the lives of all Americans from this deadly mismanagement of the corona pandemic by the current administration, but we need to protect our own benefits. This is because as surely as the moon pulls the tides, the Republicans are planning to attack Social Security, Medicare, Medicaid, food stamps, and any other program designed to help working people if they retain power after the November election. They are coming for retirees if we do not come for them first. The coronavirus pandemic is in all ways a do or die situation for the retirees in America.
This is genelantz with KNON Radio. This is the Workers Beat Extra.